According to the World Health Organization, famine is defined as regional failure of food production or supply sufficient to cause a marked increase in disease and mortality due to severe lack of nutrition and necessitating emergency intervention, usually at an international level.
Who is affected and where? People living in poor and developing countries, such as the central region of South America, East, Central, and South Africa, parts of South Asia, and Eastern Europe.
Hunger and homelessness are also problems in developed countries.
Estimated homeless figures in the United States range from 600,000 to 2.5 million in 2009. In 2002, 34.9 million people were food insecure. Many famines took place in history, such as the Irish potato famine in the 1800s, as well as the Great Leap Forward famine in China in the 1950s. Other regions of the world that experienced famine are the Netherlands, Africa, and North Korea.
Biology and genetics. Women, children, the sick, and immunocompromised are often the most affected by famine and malnourishment. Behavior and policy making. How we handle our environment, resources, and policies can have an effect on our access to food. Natural resources can be exhausted by poor farming practices, deforestation, overcropping, and overgrazing. With a lack of regulations about sanitation and with poor sanitary practices, food and water sources can become contaminated and can eventually lead to disease. Export restrictions can make food prices very volatile. When the prices of staple foods increase, the poor especially may find themselves unable to acquire adequate amounts of nutritious foods. Social and physical environment. Those living in poverty are unable to attain the food needed to keep their bodies nourished, which could lead to poor health and keep them from their full earning potential. This is what is called a poverty trap. Overpopulation and natural environments that are unable to provide decent agricultural conditions can lead to food shortages. Developing countries or those hit by natural disasters or war may lack roads for the transport of food, warehouses for the storage of food, and irrigation systems for water. Natural disasters and war can also directly destroy or contaminate food and water sources. Health services. Many of those experiencing famine and malnourishment are in poor rural communities and have very little access to health services. Some of the organizations involved in getting food and aid to these populations are food banks, the World Bank, the World Food Program, and the Food and Agriculture Organization of the United Nations.
According to the World Health Organization, malnutrition in all its forms increases the risk of disease and early death. Protein energy malnutrition, for example, plays a major role in half of all deaths of children under 5 each year in developing countries. More than 70% of children with protein energy malnutrition live in Asia. 26% live in Africa. According to the WHO, inadequate water supply and proper sanitation lead people to practice unsafe eating or drinking practices that increase their risk of food and waterborne illnesses, further exacerbating malnutrition. The WHO describes secondary malnutrition as people suffering from diarrhea who will not benefit fully from food because frequent stools prevent adequate absorption of nutrients. In addition, those who are already experiencing protein energy malnutrition are more susceptible to and less able to recover from infectious diseases. According to the WHO, around 1.1 billion people globally do not have access to improved water supply sources. Having proper sanitation and hygiene when preparing food are essential to preventing malnutrition. Food contamination is one of the major contributors to diarrheal diseases in children. The main focus on preventing the malnutrition associated with these diseases is mainly in prevention. Poor water supply, sanitation, and hygiene are all important risk factors that determine the health of a community, due in part to the increased susceptibility to diseases that lead to malnutrition.
Nurses with community and public health experience are able to provide knowledge and skill in countries where nursing is not an organized profession. Nurses provide guidance to other fellow nurses as well as members of the healthcare team. Public health nurses provide direct care and facilitate the education and health promotional needs of the community. In the community, nurses promote health by ensuring adequate food intake that meets the nutritional needs of the individual, safe and sanitary drinking water, shelter from the physical elements such as rain, wind, and cold, environmental sanitation such as a clean bed to sleep in and a clean kitchen to cook in, and immunizations to prevent diseases such as Hep B shots and MMR shots. Worldwide effort has led to a number of interventions which have proven somewhat successful in reducing malnutrition and famine. Long-term efforts to prevent famine include improving seed and farming techniques, improving the food fortification projects, and food supplements. Efforts also include providing education related to nutritional guidance and family planning to space childbirth, as well as providing the usual sanitation efforts such as clean water, clean wells, and controlling of human and animal wastes.